Well, we'd already been running a treatment centre called Cloud's House for 5 years, since 1983. And I think we'd come to the conclusion that we had developed that particular project as much as we could. The grounds were rather small, and it was well established, with good personnel running it. So we looked to expand, and having looked at various sites or areas in the country, Scotland seemed the obvious choice. My roots were originally, family roots were from Scotland, and there was no treatment centre along our lines, Minnesota model type treatment, in Scotland at all. And of course, Scotland had a much more serious rate for addiction. For instance, liver cirrhosis deaths were 60% more in Scotland than in England. So we felt that was the place to look. And eventually we were able to purchase Castle Craig, which seemed ideally sited in between Edinburgh and Glasgow, not too far from Newcastle. But despite being not far from Edinburgh, it is in wonderful, remote, beautiful countryside. So this was, and the building was perfectly able to be adapted. So this is where we settled. I started off running it jointly with my wife, who was the medical director. But my role, getting a bit older, has stepped back now in recent years, and my wife is really the kind of managing director or chief executive officer. And I perhaps look more at strategy and planning for the future and assisting my wife, really.